Hi, thanks to all Physio Harcon-2020 third international e-conference for invite me to speak on recent advancement in knee injuries in sports. I am Dr. Sajjan, Assistant Professor, Faculty of Physiotherapy, SGT University. So today's content, the common knee injuries in sports, recent advances in physiotherapy, the role of hip and core strength, what are the changes occur in brain, what is sport specific training, what is tissue engineering, gene therapy, what is platelet rich therapy, how the prevention of injuries and current evidences. The most common injuries in sports such as patellofemoral pain syndrome, tendinitis, torn ligaments and cartilage injuries, fracture, dislocation, meniscal tear and bursitis. There have been many recent advances the understanding of pathophysiology, diagnosis and management of knee injuries. These have been subject to understanding the new research which has changed the way we manage the knee injuries. In recent advancement in physiotherapy, there is movement based physiotherapy such as manual therapy. In this, the movements are used as a treatment means in this approach such as McKenzie, Mulligan and Matelete concepts. Effect of weightlessness on the body system, more rapid loss of strength and muscle mass if practiced in weightlessness without the effect of gravity. It is a recent field of study in physiotherapy. Pain science and integration. Many biopsychological models have been developed like brain plasticity, biochemistry of pain. Also ergonomics, the study of human and machine interfere. The biomechanical study and analysis of human motion, the most emerging field of physiotherapy. Another emerging field of study is artificial limb like myoelectric hand, robotic, prosthetic rehabilitation. Now, the role of neuromuscular training, such as increase in rate of coding, recruitment of motor units, synchronization of motor units, all things help to improve, depend on strength training and exercise. The role of trunk and hip control in neuromuscular training, such as the dynamic neuromuscular analysis, orientation training, appears to reduce the ACL injuries in adolescent and the mature female athletes. The targeted neuromuscular training to improve the lower extremity strength and power, reduce the dangerous biomechanical related ACL injuries risk to improve the single leg balance. There is many evidence that neuromuscular training not only reduce the level of potential biomechanical risk factor for ACL injuries but also decrease knee and ACL injury incidence in female athletes, altered or decreased neuromuscular control during the execution of sports movement, which result in excessive resultant lower limb motions and loads may increase the risk of ACL injury in female athletes. Havet et al. In 2005 described the prospectively demonstrated that measure of lower extremity valgus including knee abduction, motions, torque during jumping and landing tasks predicted ACL injuries risk. The current evidences indicate that compromised function of trunk and hip stabilizers as they relate core and neuromuscular control may underline the mechanism of increased ACL injury risk in female athletes. So the core strength and hip abduction strength and recruitment may improve the ability of female athletes to increase control of lower extremity alignment and decrease knee abduction motion load resulting from increased trunk displacement during sport specific activity. The changes in brain. A new research shows that ACL reconstruction causes structural changes in brain for the patient, hinder the recovery, contribute to performance deficit. MRI of the brain of ACL reconstruction patients show atrophy in fiber of corticospinal tract, which scuttles masses from brain to muscles. Less fiber communicate with the muscle. A recent study shows that downstream neural activity in quadriceps is impaired during sports like movement after ACL surgery, which suggests that poor brain structure and communication lead to reduced functioning. So a systematic approach should be taken not to just to improve the range of motion but also the poor movement pattern and muscle activation. Biofeedback, visual training, rewire the brain. Tissue engineering, use of combination of cells, engineering, biomechanical, psychochemical, factors to improve and replace biological tissues. The goal of tissue engineering such as to develop degradable scaffold that provide initial strength, stability of knee joint, load to better remodeling and healing. The most commonly used the tissue engineering is ACL injury, meniscal injury. The new option of ACL replacement is tissue engineering like use of autologous, allologous tissues. Patellar tendon bone autograft are the gold standard in ACL reconstruction. Now, the gene therapy. It is considered as an alternative strategy to develop future protocol for tissue engineering of meniscus tear and direct gene transfer. It is used to encode healing factors most frequently used in meniscal lesion. Mechanism. The viral factors allow the insertion of gene into the death cell and produce the gene factors. Platelet-rich therapy. The evidence is in understanding the tissue repair mechanism and provide role growth factor have stimulated the use of platelet-rich therapies by orthopedic surgeons and sports physicians. Many with the aim of stimulating and enhancing tissue healing. There is evidence that reconstruction of anterior cruciate ligament and tendon surgery combined with platelet-rich therapy enhances healing and functional recovery. The prevention of sports related injury is ideal. There are 8 potential ways to prevent injuries such as pre-season physical improvement, proper warm up, proper cool down, proper training techniques, increase training gradually, proper fitness use of fitting equipments, hydration, increase breaks, rest and recovery. For the prevention of sports injuries, we have to focus on sports specific skills while designing a training protocol for athletes. Also, the importance of conditioning. Overcome fatigue. Fatigue affects skill execution, increase injury risk, tactile judgment and ability to read the game. Motivation. Also, overall performance such as speed, power, agility deteriorates. Speed training. Sports sprints between 10 to 40 meter at 100% effort. The full recovery becomes sprinting again maximum speed development. Agility training. Drills with repetitive high intensity change in direction over short distance. For maximum speed agility, the plyometric power training ensure full recovery is reachable before starting the next repetition. There are various training programs such as neuromuscular training, plyometric training, core strength training program, balance training, proprioceptive training, strength training, resistance training, biofeedback training. The evidence is the studies show improvement in knee flexion angle and movements after plyometric based training and resistance training. The neuromuscular control and plyometric training increase in initial and maximum knee flexion angle and the range of motion. On the basis of various video assisted and verbal feedback training shows increased knee flexion angle and movements in male athletes during single leg jump. Decrease in hamstring quadriceps ratio may also the risk factor of ACL injuries. It has been found that female athletes who suffer from ACL injury had combination of decreased hamstring strength without decrease in quadriceps strength. So neuromuscular control, resistance, plyometric training increase the hamstring and quadriceps ratio. Conclusion of today's lecture is recent advancement in understanding of tissue repair mechanism have opened new perspective for new research. More research should be executed to determine the role of training components, how to prevent injuries, reduce the risk of knee injury in athletes. In conclusion, there is a need of development of specific prevention program and new techniques. A risk profile must be created to set up individuals and specific intervention program. Thank you.